Hi, Assalamu alaikum everyone. Today I am presenting a case of Theriogenology with titled Segmental Aplasia of the Uterine horn with Mucometra in a female alpaca. This case was originally reported by Ferrer and colleagues at Kansas State University and I have summarized it for today's presentation. Case introduction. The patient was a 2-year-old female alpaca that had never given birth before. So, the main concern of the owner was infertility due to multiple attempts with a fertile male. So, this case mainly revolves around exploring the cause of infertility in this young alpaca. According to the owner, the alpaca was several times mated, and each time it was lasting for about 15 minutes. After breeding, she was not receptive for 1 week but became receptive again after 2 weeks. This cycle of receptivity suggests that ovulation occurred but conception or implantation failed, possibly due to an anatomical or physiological issue. Clinical examination. On examination, the alpaca was bright and healthy and no visible abnormalities. However, ultrasonography revealed a large fluid-filled uterine horn, about 10 cm in diameter. The fluid was anechoic with some floating particles, and importantly, no uterine horn or ovaries could be visualized. Additional diagnostics. Vagina and endoscopic examination showed a normal vagina and cervix, but only a single uterine lumen was seen. This raised suspicion of a congenital abnormality. To confirm this genetic sex, a chromosome analysis was performed. Our results were 74XX, and the SRY gene was negative, indicating a genetically normal female alpaca. So next move, presumptive diagnosis. Presumptive diagnosis. Based on these findings, the clinicians suspected a segmental aplasia of the uterine horn, meaning one part of the uterus failed to develop. The accumulated fluid in that horn indicated mucometra, a build up of sterile mucus due to obstruction. So next, necropsy findings. Unfortunately, due to the poor fertility prognosis, the alpaca was euthanized and necropsy was performed. On necropsy, the right uterine horn was grossly enlarged, fluid-filled and thin-walled, and while the left uterine horn was normal in size and ovaries were also normal. The right horn ended with a blind pouch and have no communication with the uterus, and contained about around 600 ml of cloudy mucus. So here are these two pictures which were taken during necropsy. The left one, which indicating the dorsal photographic view of the genital tract of the alpaca during necropsy. The right uterine horn, represented with the point 1, is a large, thin-walled and fluid-filled structure, and the point 2 indicating the left uterine horn, and the point 3 indicating the cervix, and the point 4 indicating both ovaries within anticipated limits. So in figure 2, the dorsal photographic view of the genital tract of the female alpaca, of the reproductive tract wholly the incised. The point 1 indicating the right uterine horn ends in a blind pouch, and there is no communication with the uterine body indicating with the point 3, and the point 4 the scalpel blade, and the point 5 the lumen of the uterine horn, which is contiguous with the uterine body, which is again indicated with the point 3, and cervix representing with point 6. So notice clearly that the point of taken this picture is that the wall is so thin that it appears to be transparent or translucent in some regions, as in this figure 2. So next move, histopathology. In histopathology, macroscopically, the left uterine horn was normal, but the right uterine horn was thinner and atrophied. Both the Both these horns showed mild inflammation with lymphocytes, neutrophils, and basal cells. The final diagnosis confirmed segmental aplasia of the uterine horn, endometritis, and endometrial atrophy. Differential diagnosis. Initially, possible differentials for a fluid-filled uterus included pregnancy, pyometra, hydrometra, or mucometra, but the pregnancy was ruled out since there was no fetal structure was seen on ultrasound. Given that the uterine fluid was non-inflammatory, mucometra was the most consistent diagnosis. Pathogenesis. This condition normally originates from a flaw in the development of paramesonephric ducts, which normally form the uterus and the oviducts. When part of one duct fails to develop or canalize, it leads to segmental aplasia. The caudal right uterine horn is most often affected, as in this case. Ovarian function usually remains normal, but obstruction causes accumulation of mucus and buildup of mucus, leading to mucometra. So next, genetic and comparative notes. In a cattle, similar condition as known as a white heifer disease, which is linked to the white coat and a recessive gene. However, in alpacas, no genetic association has been yet proven. Similarly, cases have been reported sporadically in other camelids, including llamas and camels. Uh, outcome Outcome and management. Because infertility was severely compromised, the alpaca was euthanized. Unfortunately, if preservation was desired, options could include OVH, ovariohysterectomy, and a partial hysterectomy to prevent rupture or infection. Untreated, the thin-walled uterine horn could rupture due to continued fluid accumulation if we left it untreated. So next, summary. To summarize, this case involved a young infertile female alpaca with a congenital absence of the communication between the right uterine horn and the uterus. The obstruction led to the mucus accumulation and infertility. This condition is rare but important to consider in nulliparous females showing infertility with fluid filled uterine structures. References. These are the key references that describe similar cases in the camelids and the other species, particularly from the Journal of the American Veterinary Medical Association. Thanks you for your listening and cooperation. Allah Hafiz.